Hi, I'm Dr. V. I'm an interventional pain specialist and chief of the spine pain program at Bloor Pain Specialists in Toronto. But today, I'm going to be answering some common questions about low back pain and sciatica.
What do I need to know about radiofrequency ablation?
Radiofrequency ablation is a phenomenal technique. For one, it's been around since 1973. Unfortunately, in Ontario, it is very sparsely available. Very few physicians have the tools available to them, even if they have the knowledge to be able to treat patients with radiofrequency ablation. It's used in pain management, but in other fields as well. It's used in cardiology for arrhythmias. It's used in the cancer world to treat cancer, and it's used in dermatology as well. When it comes to pain, radiofrequency ablation is used to change or interrupt, stop the signal that's going through a nerve. And we do so people don't feel their painful parts. So if you have arthritis, if you have painful muscles, if you have a nerve that's misfiring or it's being pinched or it's being damaged, those signals are uncomfortable and they can be changed. So radiofrequency ablation is a mechanism for putting in a needle with a special tip and a wire on the back end that connects to the machine. And that tip of that needle gets hot or pulsates or sends a little energy waves to change the signal through the nerve. Or it gets so hot to break down a small branch of a nerve. Sometimes that's all we need. We have a small joint with a small branch plugging in. Well, if we heat up the branch before it plugs in, the branch melts down, disconnects, and we effectively unplug the joint. So we don't know we have arthritis. That screaming joint doesn't have to scream at us anymore. 5 months, 6 months, 8 months, whatever the period of time it takes for a patient to grow that nerve branch back, they have a more or less normal life. The quality of life improves. They get to play with their grandkids. They get to go to their grocery store with normal function. They get to play tennis. But when the nerve branches grow back in, if nothing's changed about the anatomy, well, it tends to feel the same. If people do a whole lot of exercise in the meantime, things they couldn't do before, they get a whole lot of core strength, muscle strength, and change the support, the ratio of support between bone and muscle, so two sides of a joint aren't just sitting on each other, where muscle is holding up our weight. When that nerve branch grows back, it doesn't always presume pain. It doesn't just assume that this is a painful joint ahead of time. It will connect, it will ask, does this one hurt? Sometimes the answer is yes, but sometimes the person's being able to change their back enough that the answer is no. It doesn't hurt anymore. And they feel better for longer that way. If you have a question that you'd like us to answer in a future video, leave a comment below. And please remember to like and subscribe.